Hi, and welcome to the WellnessFX baseline panel video where we talk about TSH. TSH, otherwise known as thyroid stimulating hormone, does really what the name would suggest. It stimulates the thyroid gland to make thyroid hormone. Now, TSH is the most common marker on blood chemistries used today to evaluate thyroid function. Now, it's the only thyroid marker on the baseline panel, and in future videos we'll talk a little bit more in depth about thyroid hormone physiology. And you can see how TSH by itself tells you only one very small piece of thyroid hormone physiology, but it's an important one as well, which is why it's the most commonly used marker to evaluate thyroid function. Let's talk a little bit about thyroid physiology in terms of TSH and how it's released in the first place. So up in your brain, you have a very important part of your brain. It's very small, but it does a lot of things in the body called the hypothalamus. Sometimes the hypothalamus is referred to as the master gland. And the reason why is the hypothalamus is involved with a variety of different functions, including things like temperature regulation, thirst, appetite, as well as a precursor for the secretion of a number of different hormones in the body. In fact, things like your adrenal glands to make cortisol really starts up in the hypothalamus. For the testes or ovaries to make their sex hormones, again, starts in the hypothalamus. And the hypothalamus is involved also with thyroid hormone production. The hypothalamus makes a hormone called thyrotropin-releasing hormone, or TRH as sometimes it's known. Now, TRH, or thyrotropin-releasing hormone, actually gets passed down through the pituitary stalk into the pituitary gland itself, and depending on the level of TRH, or thyrotropin-releasing hormone, the pituitary gland then responds by producing its hormone, TSH, or thyroid-stimulating hormone. Then the thyroid gland, in response to the amount of TSH that it's receiving, produces thyroid hormone. Now, most of it is T4, or thyroxine, about 96%. There's the rest of it really is T3, or triiodothyronine. Again, we'll talk a little bit more about those in future videos. But this here really represents thyroid hormone. Now, this will be released, bound for transportation around the body, and is your thyroid hormone that has the thyroid hormone metabolic effect. So let's talk a little bit about the feedback of how this works. The hypothalamus has some pretty major functions. But what's unique about the hypothalamus as compared to the pituitary gland, the hypothalamus not only knows what's going on inside the body, but also knows what's going on outside the body. The pituitary can really only sense the amount of hormones on the inside of the body. So said another way, the hypothalamus is involved with temperature regulation. So if it's too hot or too cold outside and you start to get too hot or too cold, the hypothalamus can help regulate that. The pituitary, on the other hand, is really just aware of the body's circulating hormones that it's involved in helping to secrete. So the pituitary senses the amount of circulating thyroid hormone in the body, and based on that, can produce TSH. So put another way, if the thyroid gland is not producing very much thyroid hormone, T4 and T3, the pituitary can sense that lack of thyroid hormone and will therefore increase its production of TSH in an attempt to get the thyroid gland to make more thyroid hormone. The hypothalamus also has an ability to sense how much thyroid hormone is going on in the body. So if somebody has low production from the thyroid gland of thyroid hormone, T4 and T3, both the pituitary and the hypothalamus will pick up that low circulating level of thyroid hormone and produce their particular hormones in an attempt to get the thyroid to make more. Now, the opposite is true as well. If somebody has high amounts of thyroid hormone or is on medication, for example, the hypothalamus and pituitary gland will sense the circulating levels of thyroid hormone and that it's high, and they will decrease the amount of TRH and TSH, because if there's high circulating levels of thyroid hormone, the thyroid gland doesn't need to be making more, and so they will produce less of these stimulating hormones to try to calm down thyroid hormone production. Now, I say all that because the hypothalamus can sort of circumvent this whole process if it needs to. For example, let's say somebody has low circulating levels of thyroid hormone. The pituitary would make a high amount of TSH. But let's say somebody had low thyroid hormone but was in a sauna where they were really increasing their temperature quite a bit. Thyroid hormone is involved with one's basal metabolic rate, or temperature, for example. If the thyroid circulating levels of thyroid hormone are low, but the body was exposed to extreme heats, the hypothalamus would sense that and think, not really, but basically say to the pituitary and the thyroid gland, listen, the body is so warm right now, we don't need to make more thyroid hormone. So despite the fact that thyroid hormone is actually low, if the body was sufficiently warm enough, the hypothalamus would, despite having low thyroid hormone levels, produce lower levels of TRH in an attempt to get the pituitary to make lower levels of TSH in an attempt to have the thyroid gland not make more because the body was so warm, for example. Now, how do we evaluate TSH on a blood chemistry? There's a few different things that you can look at when it comes to TSH. An easy one is if TSH is elevated above the laboratory reference range. If it's above the laboratory reference range, what that's suggesting is the pituitary and perhaps the hypothalamus is sensing a low amount of thyroid hormone production by the thyroid gland, and with an elevated TSH is attempting to get the thyroid gland to make more thyroid hormone. Now, as unlicensed practitioners, we are not able to diagnose that as hypothyroidism. But if a licensed medical doctor saw an elevated TSH above the laboratory range, they would diagnose that as primary hypothyroidism, that the real issue was in the thyroid gland. The pituitary was attempting to get the thyroid gland to make more thyroid hormone, but it wasn't working well. So the defect would be in the thyroid. The pituitary would make more TSH in an attempt to get the thyroid to make more thyroid hormone, but if the defect's in the thyroid gland, then it's probably not. I'll just take a quick aside right now. The number one cause of primary hypothyroidism in industrialized nations today is an autoimmune condition called Hashimoto's. Now, again, if on the baseline panel TSH is above the laboratory range, you cannot diagnose this person with primary hypothyroidism, but I would personally recommend having that individual refer them to an endocrinologist or their doctor so that they can be properly diagnosed, further evaluated, and treated for what is likely primary hypothyroidism. But as unlicensed practitioners, we cannot say that. We can simply say you might want to take this blood work to an endocrinologist or your doctor for further evaluation. So that's if TSH is high, and that's pretty easy to find. Now, on the other hand, if TSH is low, there's a variety of low TSH numbers and really what's going on. If TSH is ever low, the most common reason why you might see that on the WellnessFX baseline panel is because somebody's on medication. And now when I say low, maybe in the range of maybe 1.0, or let's just even say as low as maybe 0.5 to 1.0. If you see a TSH around this level here, chances are it's probably due to medication. Now, why would TSH be low? The only reason why TSH would really be low, for our purposes, is if the thyroid gland was making too much thyroid hormone or if somebody was taking medication. Said again, the pituitary is sensing more than adequate amounts of circulating thyroid hormone in the body, and therefore is not producing TSH because there's no need for the thyroid gland to make more thyroid hormone. So if you saw TSH at anywhere between 1.0, maybe 0.8, perhaps as low as 0.5, the most likely reason why today is because somebody is actually taking thyroid hormone medication. Now, if TSH gets sufficiently low, we'll say anywhere between maybe 0.2 to something like 0.02, then that's a really low TSH. It may be due to medication, which you should ask the client about. But there's also another condition called Graves' disease. Now, Graves' disease is an attack on certain receptors on the thyroid gland that has it produce an abundance of thyroid hormone. And because it has such high levels of thyroid hormone, the pituitary will really very strongly shut down TSH production because it absolutely doesn't need more thyroid hormone. Now, the chances of you seeing Graves' disease on a WellnessFX panel is pretty slim. There are a number of negative symptoms that are associated with Graves' disease. There's a really good chance that if somebody has it or had it, it will already have been picked up by their doctor. And there's, like I said, rare is it that you will see a TSH that low. If you do, it's probably not Graves' disease, but instead due to medications. Now, there's one other concept that's really important to talk about. There's a concept that you could refer to as pituitary suppression. There's a number of different things that can occur in the body. For example, cortisol, excess levels of the adrenal gland, adrenal hormone cortisol, as well as certain molecules produced by the immune system called cytokines during processes of inflammation, for example. Another one would be lipopolysaccharides that are produced by unhealthy bacteria in one's large intestine. All of these things have been shown to basically suppress the hypothalamic pituitary portion of this, meaning that somebody may have a, let's just call it low normal, or I'll even put normal TSH, but actually have low thyroid symptoms because their thyroid gland is not producing thyroid hormone. Well, if the thyroid gland was not making adequate amounts of circulating thyroid hormone, why would TSH be low? And something that I've personally seen very often in clinical practice is what one could consider to be a normal or low normal TSH and low circulating levels of thyroid hormone. Now, on the baseline panel, you really can't pick this up because the thyroid hormones are not on there. All we have is TSH. But if somebody reports hypothyroid symptoms, like being cold all the time, having a difficult time losing weight, perhaps dry skin, brittle nails, their hair's falling out, fatigue, a number of those different types of symptoms, those are all hypothyroid symptoms, or low circulating levels of thyroid hormone type symptoms. If they have those symptoms and the TSH is normal or even maybe a little bit low, it's likely not a defect in the thyroid gland, but rather the thyroid gland's not being stimulated to make more thyroid hormone, and it's because there's some dysfunction higher up, either in the hypothalamus or pituitary, and it's being suppressed by, like I said, lipopolysaccharides, excess cortisol, or really what one could just consider to be inflammation and some of the cytokines that are produced from that. But for our purposes, if TSH is ever above the laboratory reference range, it's probably primary hypothyroidism, which we cannot diagnose as unlicensed practitioners. However, they should be referred to an endocrinologist for further evaluation, workup, as well as treatment. If TSH is ever low, that either means that they're producing adequate amounts or even high normal amounts of thyroid hormone. Maybe they're on thyroid hormone medication. If it's really low, chances are it's, for our purposes, it's medication, probably not Graves' disease, although it's certainly a possibility in today's population. And if it's normal, it doesn't mean that their thyroid is working perfectly, that there can be some issues upstream from the thyroid gland, if you will. Well, I hope you found this video on TSH helpful, and I will see you in the next video.